Calls for stronger action to stop the abuse of children in care are growing this morning, with governments now promising a national childcare worker register, a mobile phone ban in centres and CCTV monitoring. But even 8 years after a royal commission into child abuse, one of the commissioners says the lack of action on both state and federal level thus far has been shameful, lashing politicians for their failure to act with haste in protecting our youngest and most vulnerable. For their take, let's bring in broadcaster Justin Smith and Sunshine Coast Mayor Rosanna Natoli. Morning to both of you. Justin, you are right there in Melbourne where this happened. There are even calls to ban men from childcare centres. People are frightened and angry. What national response do we need?
Look, I think the reason we're so angry about this, well, there's so many levels, but is that we know what the response should be. You know, we had a Royal Commission. We have looked into this. We've had some very, very smart people from child foundations, from former commissioners before talking about it. You know, we knew what the problems were, and next to nothing had been done about it. I mean, the Working with Children's Check system needs a complete overhaul, needs to be made national. I mean, it needs to be put on a complete register around the country in a database. And we know all this. You know, we know it. And now we're scrambling to get it right. I mean, I know there's a better late than never, but that's a very tough thing to tell victims' families. And then when, you know, in our courts in Victoria, we've had child sex offenders who walk without jail as well. What kind of message does that send to predators? We've been getting this so unbelievably wrong. And that anger that people are feeling right now is not just for the alleged crimes themselves, but for the bloody inaction that has been surrounding this industry. And I think, I'm sorry to go on, Nat, but talking about banning men from I just find that offensive and ridiculous, because if we put these other things in place, had they have been put in place, and got them working and had the experts working on it, we wouldn't be talking about it like this right now.
Yeah. Rosanna, what are your thoughts?
Well, we know we need urgent action, obviously, because this is such a serious issue. Right across the country right now, as parents are getting ready to drop their kids to childcare, they feel real fear. We, as a society, have let down absolutely massive failure to the people we should be protecting the most, our most precious resource, our children. So right across the country, as we are saying, how could this happen? We really just need to have a really clear indication from our governments that enough is enough. Now is the time, because more talk about this is too much talk. We really need this to be changed. We need to ensure that our children are protected. I can't even believe we're still talking about this in 2025.
Yeah, 10 years after a royal commissioner said, do this, this and this, here we are.
And here are the reasons why it needs to be done. I mean, it was all based on proper evidence. It is not just lobby groups that are just pushing their own barrows here. We have, you know...
We spent millions.
We spent a fortune on it. And everyone went, yes, absolutely.
Sounds
We all agree
like
with this.
plan.
And nothing happened. It was...
OK, moving on, the federal government is considering adding weight loss drugs to PBS funding. It comes as figures show obesity costs Australia at least $12 billion a year in direct healthcare costs, with 3 in 4 adults affected by it. Justin, should taxpayers help subsidise weight loss treatment?
Yeah, well, I mean, when we take a look at what obesity costs us down the track, I think, I mean, who doesn't want a magic pill? Let's be honest. And if this one works and it ticks all the boxes, yeah, I think so. I think there's a benefit in it for us.
Yeah, Rosanna, it's costing us $12 billion now. In 7 or 8 years, it's going to cost us $87 billion. That's obesity.
Eye-watering figures, but let's remember this is a chronic and serious disease, obesity, and so if there is access to medication that can help the people, and we know those figures are like 3 out of 4, if we can have medication and access to it in a way that is affordable to help save lives, and then the outcome is to save billions of dollars, that's a no-brainer. I think we really need to have a good look at this and make sure that we can have access to medication medication that will make a real impact in the day-to-day lives of Australians everywhere, right across the country.
Yeah, the ones that are tested and safe for everyone to use. Thank you very much for your insight, both of you. See you next week.